Well, welcome back to our coverage of the World Health Assembly. I'm Raj Kumar, the president, editor-in-chief at Devex, and I'm joined by Lena Wahlhed, who is the director for alliances at HemoCue. And we're here to talk diagnostics, which is a topic that I think has become very appreciated by people during this pandemic, right? Testing is something we've all kind of understood now in a very personal way. But of course, this has been a long-term challenge, and particularly when you think about non-communicable diseases like diabetes, and this is a space where you and your colleagues at HemoCue are real leaders. So we want to get a few minutes with you today, Lena, just to get your sense of where we are, given the pandemic, when it comes to diagnostics. What are some of the big themes that you're thinking about?
Yes, thank you. It is something that we have very close to our heart. Essential diagnostics is very much where HemoCue comes from. We only produce diagnostics that are needed at a point of care and can make a difference in the dialogue with the patient and the healthcare staff, so to say. And I do believe that NGOs and funders and Minister of Health, they do understand the importance of diagnostics, but the actual availability, of course, can be improved. And why is that? And why do we have anemia, which is part of malaria, malnutrition, but also diabetes and the non-communicable diseases close to our heart? And I actually used to use a symbol. I don't know if you can see it if I put it like this.
Yeah, I think so.
So this is actually a piece of Swedish crystal, but I think it's neat because it shows you a person. It shows you two children. One of these have diabetes, one have anemia, and one have hypertension. How would you know unless you have diagnostics available for the physician to see who am I to treat with what and for how long? So I think it's kind of neat because this is actually what physicians are facing if they don't have diagnostics available to them.
And what do you think is there's a lot of conversation at this year's World Health Assembly, of course, about universal health coverage. Mm-hmm. The idea of the health system, how resilient and strong it is, has come into focus given the pandemic. Where do you think diagnostics fit in there? What do maybe people miss about the role of diagnostics from your perspective?
Well, I think it needs to be seen in a big way. So if we look at what does the WHO do, they have promoted the Diabetes Compact because diabetes have such immense importance for any country, but also for low and middle income countries.
And that's big news for those who aren't following this, right? This was just last month, this big global compact on diabetes that came out of the WHO.
Yes, it was at the April 14th when it was the celebration of the 100 years anniversary of insulin. So that's when it was launched. And it just to be short about that, it's actually intended to raise the awareness of importance of diabetes, its prevention, detection, and monitoring and treatment. And it was in a way to also highlight the importance of adequate funding also for this important topic, which might not already be there today, unfortunately. So that was one of the reasons. And I think the other reason was to have all these stakeholders come together and work together, because if you have treatment available, but you don't have a diagnosis, you don't know who to treat, that really doesn't make any sense. And if you have the diagnostics, but you do not have the treatment, it doesn't make any sense. So I think that also, in a way, was an opportunity for different stakeholders to come together with the local diabetes associations that had the knowledge, that has the outreach and can also train and educate. So I think it was an opportunity to come together and discuss this in a collaborative way.
And you're thinking at a higher level about diagnostics. Obviously, you do a lot of work in diabetes, and this compact has just come out, which is an important thing. Mm-hmm. But you were getting into how at the universal health systems level, where diagnostics kind of fits in. Mm-hmm. How is the debate about it happening, and what do you want to see changed in the conversations happening here at the World Health Assembly?
I think that what we've seen in the past, there has been a lot of funding that has gone into different programs, malaria, mother and child, tuberculosis, HIV, and whereas that is important that remains, I think what is important also and these are the vertical programs, mm-hmm. to also see horizontal funding and in this sense of, and I think that can also prove to be a cost-efficient solution, because the same kind of test being used for within HIV and malaria, which anemia is part of, hemoglobin is part of, it is also part of diabetes, because many patients get anemia either because of the diabetes itself, they don't eat properly, or as a consequence of the diabetes, and they get the renal complications, so to say. So I think it's important that we have the vertical programs, but also that we look at them from a horizontal perspective.
Yeah, and in fact, there are examples during this pandemic of COVID-19 where the same testing facility used for HIV was repurposed to do testing for COVID-19. And so that infrastructure can be reused, but I guess you're saying the way we think about funding it may be restrictive in a sense. If you're just thinking about it in a vertical approach, instead of focusing on kind of a national diagnostics plan for a country at the country level, is that how you'd like to see the global health architecture thinking about this issue?
Yeah, I think so. Yeah.
And what about NCDs particularly? I mean, we got a little bit into diabetes, but let's go further on that, because diabetes is growing, the burden of disease is growing. NCDs get maybe less funding and attention, historically, at least in low and middle income countries, than infectious diseases. How are you thinking about this issue, and what messages do you have for the World Health Assembly on it?
Well, I think it's important to understand the context of these countries as well. So what is that the most important for them to act on right here and now? But I also think, so that is the short term, but they also need to look long term. So what is the progress that we would like to see? And I think health is so important to us, and it's important for the countries, and for the countries to grow, both financially, but also in many other instances. So I think health is important, and that's how I would like to frame it. Does that make sense?
It does. It does. And I'm just thinking about, you focus on point of care diagnostics. And, it's always important in these high level, especially global convenings like WHA, to think about the voice of patients. And I wonder, where do you think patients fit into this? What do they want to see when you talk to patients, when it comes to diagnostics and broader, how diagnostics fit into the health system?
I used to work with renal associations, and I worked with actually a dentist who then got chronic kidney disease. And he was very mindful when he talked about, and he said, what can be prevented needs to be prevented. What can be cured needs to be cured. And what can be treated needs to be treated. And so the earlier we start, the better off it is. But so that was what his messaging was. And point of care testing that allows testing to be done where the patient is. Those who live in rural communities, that is far from the hospital, far from a laboratory, having smaller instruments that provides the same accuracy as the laboratory test does, but doing that close to where the patient is, that can really make an impact, I believe. That's my firm belief.
Yeah, and there's a lot of technological advancement happening. I mean, even we've seen it during this pandemic that should allow that to be more possible, right?
Yes, for sure. And I think it's what is important as well when we speak about innovation, and that's also something that is close to my heart. We shouldn't, the innovation that lasts is the best innovation. And those that are intended and aimed for the destination where they are to be used by the people that is aimed to use it for the patients. So that is what I think is a very, very important parameter and topic in this discussion. It needs to be aimed for the purpose.
Right, and that's something we've certainly learned through, the many fads that happen in the global health sector, that in the end, it comes down to what do patients want and what serves them, and what can actually move the needle on these massive challenges. Well, I thank you, Lena Wahlhed, for bringing us this issue of diagnostics to the conversation around the World Health Assembly. It's an important one. Is there any final thought you wanted to give?
I would like to take back my crystal figure, and without the diagnostics, the physician has not the tools that he needs. And I think we owe our fellow citizens, fellow members of our communities, to be tested and to be treated, because health and universal health is actually something I think we should be able to take for granted, but we cannot do that today. So that is my, and there are tools available today.
Yeah, if there's anything this pandemic has underlined, it's how unequal the health systems are and how different the outcomes can be. We thank you, and we thank everyone who's following along our coverage here of World Health Assembly. Thanks for being a part of this.
Thank you.